This is the Dentist's Guide to Teeth Whitening in Singapore for 2024. Let's talk about teeth whitening. Teeth whitening is the least invasive way to improve the appearance of a smile. Teeth whitening is especially good if you have extrinsic stains on your teeth. So what is an extrinsic stain? Basically, as the name suggests, it's a stain that's found only on the surface of our teeth. So this usually comes from our diet, from tea, coffee, red wine, if you smoke cigarettes, and so on. If we contrast that with intrinsic stains, which are found inside the tooth, these stains are usually not really affected by the teeth whitening process. So intrinsic stains can come from medications. So for example, if you were given a certain type of antibiotic when you were a child, or your mother took that antibiotic when she was pregnant with you, you may have intrinsic antibiotic staining of the teeth. Age-related color changes are also intrinsic stains to a certain extent. Let's talk a little bit about the chemistry of teeth whitening. So how does teeth whitening change the color of our teeth to lighten them over time? Basically, what is happening during the teeth whitening process is that there is a process of oxidation, and that oxidizing force is coming from the whitening gel. So when this whitening gel molecules encounter a stain molecule, it will break down the stain molecule into smaller molecules that don't appear so dark, and that is how teeth whitening lightens our teeth. There are 3 types of teeth whitening treatments that are available in Singapore. Number 1 is in-office whitening. Number 2 is take-home professional whitening. And number 3 is over-the-counter whitening products. Let's talk about these 3. The first one is in-office whitening. So this is usually done in the dental clinic under the supervision of a dentist, and it is the most predictable and the fastest way to get your teeth whitened safely. Usually we use pretty high concentrations of hydrogen peroxide, usually with the assistance of light. So the light will generate some heat, which will accelerate the whitening process. If we look at take-home whitening treatments, these are also supervised by a dentist, but these are not done in the office. It's usually performed using a combination of customized whitening trays that are made to fit your mouth and your teeth, so that we get a really good seal of the whitening gel against your teeth. Your dentist will show you how to dispense the gel into these personalized whitening trays, and usually this treatment will take about 2 to 3 weeks to get maximum whiteness. So for in-office and take-home, the results are pretty similar in my experience, the main difference being the time frame that is required. So take-home whitening would be more suitable for patients who are not on a really tight schedule. For example, I have brides who are getting married like next week, they don't have time to do take-home whitening, so in-office would be more suitable. But if you are someone who has tried in-office whitening before, or you have quite sensitive teeth, then generally I would advise take-home whitening because it's a lot more gentle. There's no heat at all because we are not using any light. And you can also customize the whitening program if your teeth do get sensitive. And the final category is over-the-counter whitening products. So this is basically anything you can buy at a pharmacy without a prescription from a dentist. So there's a whole range of products. This includes whitening toothpaste, mouthwash. There are also strips. So for example, the most famous one is Crest whitening strips. You can also get some version of light or LED assisted whitening. I've seen that on platforms like Shopee or Lazada as well. So the main difference between all these professionally administered whitening treatments and over-the-counter is basically the maximum amount of the whitening agent that is permitted to be contained in these products. So in Singapore, the HSA, which is like our FDA, has said that the maximum concentration of whitening chemicals that can be found in over-the-counter products is only at 0.1%. So even our take-home products, they will have 60 times more whitening chemical inside compared to something that you can buy over the counter. And of course for in-office, the light, that's even higher than take-home. So you're probably looking at about 180 times more concentrated than anything you can buy over the counter. A word about unlicensed products. Now there's quite a proliferation of products that claim to contain like professional strength whitening ingredients. So if they contain more than 0.1% of hydrogen peroxide, it's not something that can legally be sold in Singapore, especially if you're not buying it through a dentist or dentist office. At the worst case scenario, if you use these products, is you may develop chemical burns or other issues like maybe the nerve of the teeth dying if the concentration of the active ingredient is much higher than what is stated on the product packaging, and that may lead to you needing procedures such as gum graft or even like root canal treatment in extreme cases. The best case scenario is that the whitening product does not work because there's no active ingredient, or maybe the active ingredient is not in a high enough concentration. So unlicensed products can be tempting because of course they're a lot more affordable than professionally supervised whitening treatments, but these are actually medical products and they are controlled as such for your safety. And a final word about whitening, a lot of patients will ask me, is it permanent? Unfortunately, there's no dental treatment that is permanent. Even if you do not develop staining on your teeth from extrinsic stains, which we talked about, like if you don't drink tea or coffee and you generally don't get stains on your teeth. As we get older, our teeth will just tend to get more yellow. It's a natural part of the aging process. So even if you never get any staining, a lot of patients as they get older, they just feel that their smile is not as bright as it was when they were younger. And whitening, I find, is the most bang for your buck in terms of like rejuvenating or like so-called anti-aging treatment of the smile, because it can just brighten up everything and make everything look fresher and cleaner. So a lot of patients really enjoy it for that reason. And if your teeth are in generally good condition, you don't have a lot of old fillings or old crowns that are discolored. I've had patients who came seeking veneer treatment. After they've done whitening, it's basically almost as if they got veneers and they're so happy that they don't end up going ahead with the veneer treatment. So whitening is really an essential part of the modern cosmetic dentistry practice because it's really minimally invasive. There's no like drilling of your teeth, unlike if you decided to go for veneer, and it can treat a whole bunch of teeth at the same time, so the cost effectiveness is really good. However, if you have tried like whitening in the past and maybe you're not super happy with the results or you felt that it didn't last for a long time, of course there are other cosmetic treatments that we can talk about in the clinic with you to see if it would be suitable. One being veneers, which I mentioned, which can give you a so-called permanently brighter smile, but that treatment does come with more invasiveness, and you do have to remove a little bit of tooth structure as compared with whitening. So that's the lowdown on whitening in Singapore from a dentist for 2024.